Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management of menopause or hormone replacement therapy. Hormone replacement therapy. In hormone replacement therapy in females when whose uterus is intact. If uterus is intact, then we should give estrogen plus progesterone are given. Progesterone protects the endometrium from downregulating the estrogen receptors. Second, hormone replacement therapy in post hysterectomized patients. In post hysterectomized patients, already hysterectomy is done. So, only estrogen is sufficient, progesterone is not necessary. In hormone replacement in women with post hysterectomized patients, we should give only estrogen as hormone replacement therapy. There are certain conditions where, even in post hysterectomized patients, we give estrogen and progesterone. That is, there are four main conditions. One, if hysterectomy is done because of endometriosis, if hysterectomy is done because of endometrial cancer, if hysterectomy is done because of endometrioid variety of ovarian cancer, or if supracervical hysterectomy is done. In all these conditions, estrogen and progesterone both are given. Disadvantages of hormone replacement therapy. If estrogen alone is given in a female with intact uterus, then the patient will have endometrial cancer. If estrogen alone is given in female with intact uterus, then the patient will have increased risk of endometrial cancer. If estrogen along with progesterone is given in patients has hormone replacement therapy, then the patient will have increased risk of breast cancer. Because of hormone replacement therapy, triglycerides will increase. As a result, the patient will have increased risk of coronary artery disease. Because of hormone replacement therapy, clotting factors will also increase. As a result, the patient will have thrombovenous embolism. Only
thank you and thank you for watching.